Hey there, Todd Cameron here, GP and founder at M3 Health. Today I want to chat to you about a really cool opportunity to join us at our Ascot Vale Respiratory Clinic for a locum position, and the pay is exceptional. Let me walk you through the details. Obviously, this little bugger has caused a fair bit of disruption to all of society, but in particular healthcare, and that is ongoing even now. And in particular, it's had an impact on young families. Being able to get an assessment for a child that's unwell with a respiratory illness or febrile illness has been increasingly difficult. And anyone, adult or otherwise, that's had respiratory symptoms, even if they're long-standing, COPD, etc., has been difficult. Asthma, other respiratory conditions, it hasn't really made a difference. In many cases, they've ended up in ED because general practice hasn't been well set up to manage them. And that's fair enough. Look, the reality is that in general practice, if you're a GP and you were to contract COVID, there's 5 days at least that you cannot be in the clinic. And so that may cost you somewhere between sort of $7,000, $10,000, $12,000, depending on the type of work you're doing. So that is a huge risk for anybody to accept. And so it is no wonder that this has not been taken up enthusiastically in general practice. And so what we've done is we've wanted to create an environment whereby you can customize your PPE, what you're comfortable with, and obviously meeting minimal standards, but elastomerics are on the table if that's what you prefer, because we know there have been a lot of places where they haven't been able to cater to this type of care. As I said earlier, that's been true of general practice and also ED departments at certain times. Certainly the health system has been overrun. At the time I'm doing this in mid to late October, we're in a trough of waves of COVID, but there's more coming. You can pretty well set your watch for 10 weeks in between the peak and the trough. The Royal Children's Hospital has been a really, really busy place in the emergency department because of the fact that we have not been able to cater to everybody. So our mission in this clinic is to do cradle to grave medicine. Look, that's general practice anyway, but it's really important that we make sure that we are including kids as young as newborns in our cohort that we're looking after, because that, again, is the bread and butter of what general practice do. This is a great way to demonstrate the value that we offer the health system, and the key things about what it is that we need to be considering with you. You must be VR. You must be a VR GP. This clinic still relies on the MBS for funding, as well as being augmented by state government funding. So I'll walk you through exactly how you get paid in a moment. But what you can rest assured of is the gender equity gap for pay, the gender pay gap, is closed with this agreement. So it's really cool, and I'll walk you through how that is. So a 19AB DPA exemption is fine, because it'll just be a locum 6-month term. At the moment, as I said, this is funded by the Victorian state government. It is not a federally funded respiratory clinic. And so what that means is we still need to use the MBS item numbers. Those are mostly attendance item numbers, level B and level C mostly, and sometimes the COVID item number as well. This clinic is funded until May of 2023. So if you're the right person, you have got guaranteed work up until then. It's in Ascot Vale, right near the showgrounds in Melbourne. Very easy to get to, tram stop right out the front. It looks like this, great clinic. It's been around for a long time, but very well designed. It has doors on both sides of the consult room so that you can move quickly and efficiently between the rooms. It is open 7 days a week, as is mandated by the contract with the state government, and we run 8 till 6 p.m. every day, no matter what. One day we usually do 1 until 9 or 10 p.m. So there is some requirement for after hours, and at times when there's a big wave, we'll have to extend those hours from 8 a.m. until 10 or 11 p.m. But we'll chat about that at the time if that's right for you. And the ratio is 1 admin and 1 nurse, 1 GP. That's pretty awesome. You'll probably never get that in general practice because it wouldn't be sustainable otherwise. The clinic itself is designed to be really efficient for the type of work that we do. So we use things like Stream Decks to automate entry of data. The swabs are being done on site. The nurses are doing that. You should find that this works really well for you. Relatively low cognitive load. You are in PPE, of course, for the shift, which can be somewhat taxing, but we'll make sure we choose the right stuff for you. It's a locum position. So previously we had these as salaried positions, and I'll tell you something really weird. People didn't really go for it because they'd never been used to receiving super or sick leave or holiday leave, and so it's actually a bit of a waste of time. So what we're doing is we're paying you a proper locum rate, which means you get paid your rate plus GST. Now you have to pay the GST onto the government, of course, but the rate is $200 per hour in normal business hours, $220 per hour in the after hours period, so weekends or if you do the evening, and it is 10% of the MBS that you bill as well. So you're talking $240 an hour to $250 an hour for that work. It's hard to get more than that, and even better, you're not going to be at risk of an MBS audit or PSR or anything else that might be associated with a high personal exertion income rate. So I've only got a couple of these positions available. Ideally, people choose 3 days a week that they work, and it's an 8 till 6. So in that, we'll usually have a 1 hour break in the middle of the day. Thank you for listening to this. And if you, depending on which channel you've seen this in, if you have a link where you can do an application through the type form, please do that. Otherwise, you can email me at tcameron@m3health.com.au. I'd love to hear from you. As I said, 2 positions, and these are through till May next year. Look forward to seeing you. You must be comfortable with seeing all patients for respiratory illnesses. It's a huge community impact. Let's get to making that difference and show everybody what GPs can do, because we know it's pretty awesome. All right, I've been Todd. Bye.